So when we communicate with the community, we need to understand what's their needs rather than just communicate what we want to talk to. So Health New Zealand, they provide the funding to different service providers to provide support, free, confidential and professional support to everyone.
Kia ora whanau, welcome to another podcast. I'm really excited. We have a special guest here. I'm joining here today to co-host this podcast with my colleague Rata. Rata, how are you?
I'm great. I'm very, very excited. Yeah. How are you today, Coach?
Good. How was your week going?
Good. Very, very good. It's another pretty good week in Wellington winter, but we've got some exciting things happening to keep us going and to keep us
Absolutely.
Yeah.
And exciting. We're receiving some awards and stuff.
Oh yeah, true. And a lot of successful people around these times doing amazing mahi. So always very, very good. Yeah.
Awesome. So we have a very special guest, Hong. Did I pronounce it correctly?
Oh yes, correct. Yeah, Hong. I always joke that Hong for Hong Kong.
Right.
So too easy. Yeah, easy to remember. Yeah. Hong, H-O-N-G. Yeah.
H-O-N-G. Great. Very, very welcome. I want to ask you first, how are you doing?
I'm very good, and thank you for inviting me today. I'm very good. I just came back from Auckland for very, very, exciting mahi I did with our Lived Experience group. I probably can share with you something later. Yep.
Wow, that's amazing. So, when I first connected with you, I think it was during the panel, right?
Yes, correct.
Remember, 2 years ago or something?
Yeah, three years ago.
Time is going fast, eh?
Oh, gosh, yeah.
I was impressed in the passion you have and then also the mahi you guys doing. So before we go talk on all this mahi, first I do this with the guest, tell them if I give you the mic, want to introduce yourself, how you want to introduce yourself.
Okay, cool. So kia ora koutou. My name is Hong. I work at Asian Family Services as a national manager of public health and communications. I came to New Zealand 12 years ago with my husband. I'm originally from China. Before I came to New Zealand, I was an accounting lecturer. I taught accounting in a university. And when I came to New Zealand, I didn't study at all, but I found my passion in journalism. So I did 7 years journalist for Chinese media and social media company in Wellington. Back to 2020, just before the first lockdown, I found a job opportunity working for Asian Family Services. So yeah, for my past 5 years working at Asian Family Services was amazing.
Wow.
Yeah.
So you're a communicator.
Yes, I am. Sort of.
Right. So I want to start with this one. So how important is communication with people and the role that you're doing? How important is to have a communication which is talk about the service, talk about the important messages that organization sends to their client or to the people they are serving? How important is that for you?
Very good question. Thank you, Kodrian. I think communications really depending on who we are talking to. So, for example, within my working scope, I do a lot of different communications with different people. So, the top priority is our community. So, when we communicate with the community, we need to understand what's their needs rather than just communicate what we want to talk to. And second, my target audience or I communicate with is government because they have the power, because they are the policymaker. So when we communicate with them, I think it's very important to bring the community voice to the table for the policymakers to think about. What are the needs from the community and what does a better policy mean for the community they should think about. And the third communications, I would say media and social media. It's very important and it's an online world for everybody. But how we can better utilize the different channels to deliver the messages. It's very important as well. Yeah. And maybe last communications is stakeholders. So when we say stakeholders, including the communities we work with, including the organizations like Voiceofaroha, So if I communicate with you, I need to understand what do you need and
Yeah.
what's our common topics. So I think communications is all about find the common interest, and communication should be win-win situation.
Yeah, yeah. No, I love that, how you divide it into groups and you put the community into heart, which is like the people that serve, to get that communication to it, to understand their needs as well, which is, I very much agree on the different level of different communication, different groups that they need to know different information or different invitation for different events. Let's go. That's a good start. I want to think, Radha, you have a question before I jump into my other questions?
I was just curious, like, it's a very interesting journey going from lecturing accounting to then to journalism in New Zealand and then to health. So I was wondering, you said you found your passion really here, but what kind of, can you tell us more about that, and what was that journey looking like for you entering into health, and kind of where is your passion there and for Asian Family Services, and what drew you to it?
Yeah, I think being an immigrant, I think the challenges for everybody is sometimes we couldn't find where should we, how could we adapt to the New Zealand society, especially we come from a different culture. So I remembered, so when I did my journalism job, I interviewed a lot of community members. I found the passion, and I really want to bring their voice up, and also, do something for them to make their life better. So 5 years ago, when Asian Family Services recruited the health promoter in Wellington, they want to find a person who has community engagement skills and who has communication skills, because when I did when I was a journalist for different social media and media companies, I built up my social media management skills. So when I applied for the job, actually the first task they gave to me was build up our Chinese platform, social media platform. Back to 5 years ago, we only have 200 followers.
Wow.
But now we have 8,000 Chinese followers. So I found that I have the passion to, build up the community's capacity to understand, the current New Zealand health and mental health system, and help them to navigate well to seek help. I think hopefully I also answer your questions.
That's beautiful.
Wow.
I love how you say that you found your passion for the community through that journalism, and through hearing so many stories that inspired you actually just to go and really want to tangibly make such a difference. That's a very, very beautiful journey. So thank you for sharing that. Back to you, Kodrian.
So now talking about the mahi you do, Hong, what is exactly Asian Family Services they do? What is the programs there? If you can talk to us and the people who are listening or watching who may not hear about it. So what exactly they do?
Yeah, so like I mentioned before, Asian Family Services was established in 1998. So the core services we provide to the community, including gambling harm minimization, general mental health, youth mental health, parenting. We do a lot of Asian research as well. Because evidence-based, data and information is so crucial for the Asian community to find, equitable resources for our community. So gambling harm minimization services is our core services, because gambling harm, it's really, really big problem for Asian communities. So probably for some of you, when you went to, Sky City, you will see a lot of Asian people there. And when you go to the, poker machines, venues and other TABs, a lot of Asian people there. But the challenge is, because due to a strong stigma, because gambling itself, it's a stigmatized word for Asian community.
Right.
So actually, a lot of harm happened in the community. I give you an example. 2 years ago, I supported an Indian family in Johnsonville. It was a very sad story because the mom approached to us to seek help because of her husband's gambling problem. So the husband went to everywhere he can gamble, lost a lot of money, and when he back to home, he beat his wife and son. And the wife started to think about like, oh, probably I was the reason he went to gambling because I didn't work. So he wanted to earn more money through gambling. So she experienced, very, 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 like a lot of mental health challenges. She even thought about took her own life. But luckily, her son recognized the issue his mother experienced. Her son found our information on our website, Google searched, and her son made the call to us. And I met them, and I told the mom, I said, it was not your fault. And we can do something to help you, and we can do something to help your family. To understand how the gambling affect you, understand the mental health, challenges or the issues, why it happened to you, and actually we can do something for your husband as well to help him to truly understand what does gambling addiction mean to him, and what we can do, like together to support your family to go back to your right track. Like gambling harm is not only just the money loss, but also, family relationship.
Absolutely.
Yeah, because of people, gamble a lot and they lost the money. They also lost the time they should spend with their family members rather than go to gambling every day. So gambling issue is a big problem for not only just for Asian but for other ethnicities as well. So Health New Zealand, they provided funding to different service providers to provide support, free, confidential and professional support to everyone affected by gambling harm. And Asian Family Services, we are one of the service providers, and we are the only one Asian, targeted or focused service providers, and then we are national service provider. But back to 5 years ago, 5 or 6 years ago, we found actually a lot of non-gambling related mental health issues happening in the community. So we established our Asian Wellbeing services to provide non-gambling mental health support to our Asian community. And then we realized, because of we all come from different culture, a lot of conflict happened between the parents and the kids. So we so we want to do some parenting course for our Asian immigrants parents, to equip them with better understanding about their children's emotion and better communication skills. So we had parenting programs. And last year we got the funding to establish our youth mental health team in Auckland to provide in-school program to support our young people. So I think that's major services, and we provide to the communities. Yeah.
Wow, what a great services and the much needed support, that's for our families who come from different backgrounds needed. But so from your experience now, the organization experience dealing with a lot of issues here, do you have any challenges that could happen in a system base, which is government level or community level? Because what I understand, coming from also refugee background or different cultures, there's something that they call it shame. So our community afraid to report back. So how you guys deal with those kind of families, which is like what you just shared, if it's that son have picked up that call, and but I believe they go through a lot of that process if someone need to help, but if they help, is first shame because of the cultural background. The second, the system will hold their name in a blacklist
Yes, absolutely.
Because they put them somewhere. This was addicted or something, so they've been prevented to apply for next job or whatever happening. So how any challenges have came across, any family, any stories you have there when you dealing
Yeah,
with?
yes, absolutely. A lot of challenges experienced by the community. I would say the most important two are so first one, language.
That's one, yeah.
Language barriers.
Yeah.
So even I think for us, even we can speak good English, I would say, but when you experience mental health challenges, you couldn't express yourself in English.
That's right.
So I think the language barrier is a like a very
Like a big one, yeah.
barrier, and also because of the language barrier, people is so reluctant to seek help because they will feel like embarrassed if they go to English speaking mental health professionals. If they cannot understand what the professional is talking about, they will definitely feel embarrassed. And another challenge is cultural barrier. Like mental health, another thing that our Asian country or refugee background people back to our mother country is not the topic that we can openly talk about. So a big shame, a big stigma around it. So we previously we did a talk to other organizations to share. So when you say mental health, so you say, hi, you have some mental health challenge in Chinese with, or other Asian countries, we will translate into you are mad.
Yes, that's
You are crazy.
crazy.
But
That's
no,
what they understand.
Yeah. So it's our very very typical understanding of mental health in in Asian countries and other countries. Yeah. So so language and cultural barrier definitely the biggest barriers. And I think the another thing is the barriers for the government. Sometimes they cannot recognize the barriers.
Right.
They say we have a very good system in New Zealand, but they didn't realize the lack of the workforce. So for example, if today, Caldrian, I ask you, do you have any refugee background counselor in New Zealand? How many? No.
I don't remember if there's any.
No.
Maybe there's some there, but
Yeah.
not sure. No.
And their services is invisible.
Exactly.
We don't know where are these services available for us.
Yeah.
Yeah, so I think that a lot of challenges, and I just mentioned another one is, so all of the challenges is connected with each other.
Yeah.
Another thing is we didn't say any mental health prevention projects specifically focused on Asian communities, refugee communities. No, nothing. Yeah,
Right.
we say some mainstream mental health prevention. I think in this sector we always say prevention is better than cure.
Yeah.
But how about Asian communities? Now we 70% of the whole New Zealand population are Asians.
Wow.
Where are we? We didn't see us in the national campaign. No, not at all. Yeah.
That's right.
Yeah, and also for our Pacifica whānau, our Maori whānau, our refugee whānau, where are we? We didn't see that. Well, hopefully in the future the government can invest something to really make the prevention visible. Yeah, for specifically for us. Yeah.
So when you're talking, you just bring me. That's all right. I will go with the question. A very interesting conversation here because you're talking. You remind me in the some politician, they may undermine understanding of the culture here. When we talk about, let's say, Tanada Whenua, the more they have their own world of view of things.
Yes, absolutely.
Because they know how to communicate with their people and what's work. Which is the same thing with our Asian or migrants backgrounds. They have different way to deal with these different cultures because we are very, very diverse in these ones. So what do you would say for those who would say, oh, we all want that one, which is all New Zealand to be the same, to access the same level of service, but what will happen when someone need extra help in let's say in English? They don't get this politicians. So how do you think your organization through you guys communicating these challenges to the government of the day?
Yeah, so very good question. So firstly, so Asian Family Services, we can provide 8 different language support, including English, Mandarin, Cantonese, Korean, Hindi, Thai, Vietnamese, and Japanese. So I think so sometimes we advocate for language support because I think a lot of governments they think translation works, but unfortunately translation doesn't work sometimes. Because we do a lot of translation work during the COVID period. Because during COVID period, the government translation is so slow. And the community, they didn't know where to seek help. So Asian Family Services Way voluntarily to translate some information into different languages and, like put it on our website. But when we challenge the government that all the government websites are English, don't rely people who don't speak English to go to English website to find your, like translation resources. No, not at all. Yeah. So I think, so like you just mentioned, the language support. So firstly, we don't say interpretation services available. It sometimes it's available, but very limited. Very
Right.
limited, support
Yeah,
to
okay.
the people who don't speak English. Yeah. Hopefully, I answered your question, so I go too far.
No, it's good. It's just about like telling the government that the importance of having such a services, because I think you answered well that people may not go to the English website. They may go something that I heard is Asian support services. I will Google that better because I may see these people will talk my language or they'll understand me. That'll be much better choice for me instead of going to other one. But again, we need the other one, the main one, to have all the information of the country and things, but you need someone to implement that,
Yes.
which is
Yeah.
those kind of coming community organization like you.
Yeah, definitely. And another thing I want to say is trust.
Definitely, yeah.
People
right.
will go, so, for immigrants, for refugee community, for people from different culture, we only go to the organization we trust.
Yes.
If they don't trust, they will not, like build a relationship. So we always say for collective culture, building relationships is the most important thing. Like Way Asian Family Services, we have been in the sector for 28 years. We are trustworthy, like organizations. So why people come to Asian Family Services, why they share their challenges, because because they trust us.
Yeah.
And we want government to acknowledge this trust. So this trust doesn't build up, in one day. No way. It's years.
Yes.
Yeah, it's like
Yeah, Absolutely. No, that's great. Thanks for sharing that. Hata, you have a question?
I think that makes complete sense, and especially when you're dealing with such sensitive issues and such, big challenges for yourself, your family. It makes complete sense that you'd want to go to someone who, or go to a service that you feel like you're going to be understood by and not judged for, or be able to communicate clearly with. So, I really, really want to acknowledge your mahi and how much you've done to step into that gap that's been there. I was just wondering from I guess transitioning a little bit more to a personal level, what it was like for you stepping into this role in during those COVID times, or in 2020. That would have been such a big challenge and journey.
Yes.
And I was just wondering if you could describe kind of, I guess, some of the key challenges, but also key things you've learned from that period and your time at this role.
Yeah. So good question. I remembered when back to 2020. When I started my work at Asian Family Services, my husband and I, we lived in apartment. Because we cannot go anywhere, so we can always hear the echo in the room. Sometimes I cannot hear what the other people talking during the meeting. And so personally, I think, for me, I think, like looking after yourself is very important. So every day, because I lived in Barampo, and we had a we worked to the to the beach every day. You walked down and
Yep.
through to Island Bay, and like walked around. It's very important for like self-care. And another thing I did during that period, that I create a Chinese WeChat group. So WeChat is a Chinese social media platform. I create a group, and so every night at 8 p.m. we share. So everybody in the group, we shared one sentence to appreciate today's, like maybe somebody helped you today, maybe somebody said thank you to you today. So we share the gratitude in the group. So I think so self-care is very important. And another thing during like COVID, I found like so how to love yourself. So self-care, like we have 5 ways to well-being. So first one is notice. So notice yourself, notice the changes around you, and keep learning. So I remember in 2020 I started to learn something about public health, because I was from accounting background. I found like keep learning is very important. And third one is connect. I think COVID time taught us how important
Is connection.
of the collection.
Yeah.
Yeah, we miss our family and we cannot go back to our mother country. So starting from 2020, I started to have video call with my mom every day until today. Yeah. I think that's a learning for me on a personal level during the COVID period. Yeah. And enjoy the online world.
yeah, absolutely. Wow, that's amazing.
Thank you, Hong. It was beautiful. Yeah.
Yeah. So we're coming just kind of like time for 1 or 2 more questions. You want to go? I should go.
You go, Kodrine.
Yeah. No, this is like I'm really enjoying the important needs of the services, and also I see the passion why you're doing this, which is great to have people like you to do this, because when you care for yourself, care and love to the community, the service will be improved much better, and much people will get better service. So for the people who want to, let's say, access to the service, how they can find it? Do you guys have a website? Where else they can contact you?
Yeah. Thank you, Kodria. So Asian Family Services, we have our website. You can Google search Asian Family Services. And also we have National Round Asian Helpline, which is 0800 862 342. You can call us from Monday to Friday, 9 a.m. to 8 p.m. And our services is available in 8 different languages: English, Mandarin, Cantonese, Korean, Hindi, Japanese, Thai. So feel free to call us, and our Asian helpline is totally free to anybody.
Right.
So feel free to call us during our working time, even it's without our working hours.
Just text, reach out.
Just to leave a message.
Reach out.
Reach out. We will call you back. Yeah.
Okay, amazing.
And also I want to say we can provide free and unlimited counseling sessions to anybody who experiences gambling harm. And we also can provide general mental health support to our Asian people. Yeah.
That's wonderful. That's amazing. And the last question, what would be your message? We ask this: any message you want to send to the audience who are watching or listening to this podcast?
Yeah. So firstly, I want to say love yourself. We are very brave to choose come to New Zealand to be our second home. Reach out. You're not alone. We're here to support you. Be brave. Embrace yourself. Love your family. Love yourself.
Love it.
Beautiful.
That's a
words.
great one.
Yeah.
It's great to
Cool.
do with that one thing. So one thing left, which is a question from a previous guest, and which is a tradition we're using in this season 6. And you will also have opportunity to leave a question for the future guests that we will have. So let's see what question they have left you here.
Oh, I love this.
Where is that? Is this the last
Upside
one?
down. Yep.
Upside down. Okay. Is this the last one?
Yeah.
So where's the question? read it to her.
What single, book, movie, and album would you take with you on a deserted island?
Oh gosh.
What
What's
a
a book,
question.
movie, and
Yeah.
album?
Movie and album. Okay. Yeah, good question. Because I watch a lot of Chinese movie.
So we take one of them.
Yeah, very hard question to answer in Chinese.
Yeah.
And I listen to the Chinese music as well. Yeah. Okay, cool. Do you really need the names?
Well, even if you tell us, we will not know. Maybe.
I feel like the audience would be keen,
There'll be
maybe
some
any
people,
recommendations
yeah.
for.
Go.
Yeah. Okay. Cool. Yeah. Oh gosh.
And the deserted island?
On deserted island.
Yeah, so man, you're sitting
So what's going to be listening to it again and again and again, watching that movie
gosh.
over and over and over again. Yeah.
Maybe I really love what's the name of that? E.T.
Oh yeah.
Yeah.
I've actually never
E.T..
seen E.T.
Oh
I know,
really?
but apparently it's a great movie.
Yeah,
It's a really
very
good movie.
great one. And album, maybe the Chinese traditional music because currently I'm playing Chinese traditional instrument. So I would like to bring which is called erhu. So erhu is a Chinese Chinese traditional instrument. I would bring a album of erhu with me, listen again and again. Yeah.
Right,
And there was
amazing.
and one book as well to bring on
One
the deserted
book.
island.
It's
Yeah.
good as well.
3 questions in one.
Okay. I don't really read book recently.
So maybe just the movie.
Yeah, just a movie.
Just
Yeah,
amazing.
yeah.
Awesome. So thank you. So by that one, we're coming to end for this podcast for today. So thank you, Rata. for
Thank
hosting
you, thank
this.
you, and
Yeah,
thank you
thank
so much, Hong,
Yeah,
for your
thank
incredible
you.
kororo. Yeah.
Thank you so much for coming,
Thank
for
you.
your
Thank you so
kororo,
much.
for your mahi you're doing. And keep it up. We may see you in future podcasts and
Of
coming
course.
up opportunities.
Yeah. When
Awesome.
we have podcast, we would like to have you as well.
Thank you. Yeah, definitely we will be in touch. Great. Thank you, Fana, for listening and watching this podcast. Hope you find it useful and had a great korero or watching and listening as we did today. And we see you next one. Ka kite.